Hi everyone, welcome to this channel today. We are going to talk about breech presentation, so if you are new here, please go ahead and subscribe. Breech presentation is the topic. The incidence of breech presentation is about 20% at 28th week and drops to 5% at 34th week and to 3 to 4% at term. Near term, the fetus typically turns spontaneously to a cephalic presentation as the increasing bulk of the buttocks seeks the more spacious fundus. However, if the fetal buttocks or legs enter the pelvis before the head, the presentation is breech. So in breech presentation, the lie is longitudinal and the pedalic pole presents at the pelvic brim. It is the commonest malpresentation. There are two types of breech presentation: complete and incomplete. Complete flexed breech, the normal attitude of full flexion is maintained. The thighs are flexed at the hips and the legs at the knees. Complete breech have one or both knees flexed. Complete breech has two buttocks, external genitalia, and to feet at the presenting part. Complete breech is commonly present in multipare and accounts only 10% of breech presentations. Incomplete. This is due to varying degrees of extension of thighs or legs at the pedalic pole. With incomplete breech presentation, one or both hips are not flexed, and one or both feet or knees lie below the breech, such that a foot or knee is lowermost in the birth canal. Frank breech, footling breech, and knee presentation are the three varieties of incomplete breech presentation. In frank breech, the thighs are flexed on the trunk and the legs are extended at the knee joints. Frank breech is commonly present in premigravide, accounting about 70% of all breech presentations. With a frank breech presentation, the lower extremities are flexed at the hips and extended at the knees, and thus the feet lie in close proximity to the head. A footling breech is an incomplete breech with one or both feet below the breech. Footling presentation makes 25% of all breech presentation. This brings an end to the video. Thank you for watching. Next video coming soon.